This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Primacort 100mg injection is a powerful corticosteroid used for various medical purposes. It helps manage inflammation and immune responses effectively. Indications and uses. This injection is indicated for the management of endocrine disorders, rheumatic disorders, hematologic disorders, and various autoimmune diseases. It is also employed to manage dermatologic, ophthalmic, gastrointestinal, respiratory, and neoplastic conditions. Moreover, it serves to replace insufficient corticosteroid hormone levels and is beneficial in managing edematous and allergic states, including medical emergencies like shock and severe allergic reactions. How it works. It works by replacing insufficient cortisol levels in the body and blocking the production of chemical messengers responsible for inflammation and allergies, resulting in reduced swelling and pain relief. Directions for use. Primacort 100mg injection will be administered by a qualified healthcare professional either as an intravenous injection or intramuscular injection. The appropriate dosage and duration will be determined based on the patient's age, body weight, and specific medical condition. It is crucial to adhere to the doctor's recommendations to ensure safe and effective treatment. Possible side effects. Common side effects include pain and swelling at the injection site. In rare cases, more severe reactions may occur, such as skin reactions or anaphylactic reactions. Precautions and warnings. It is essential to use this injection with caution in patients with existing conditions such as kidney or liver problems, heart disease, and those who are pregnant or breastfeeding. Patients should inform their healthcare provider of any prior infections or other health issues to avoid potential complications. FAQs. 1. What is Primacort 100mg injection used for? It is used to manage endocrine, rheumatic, and hematologic disorders, among others. 2. What are the side effects? Common side effects include pain and swelling at the injection site. 3. How does it work? It replaces cortisol levels and blocks inflammatory messengers. 4. How is it administered? It is given as an injection by a healthcare professional. 5. Is it safe during pregnancy? Use with caution and consult your doctor. Thank you for watching. If you have any questions or suggestions, please leave a comment below. Your feedback is important to us.